Hello and welcome. I'm your host, Emily Riley, and thank you for joining us. Like many of you, I live with MS. I work for the National MS Society in the DC area. I'm also a certified group fitness instructor and certified personal trainer with over 6 years of experience creating and teaching adaptive fitness classes for those living with MS. We are excited to launch the first of 3 program sessions in the Pathways to Wellness in MS series. Our first session, MS Wellness Research, highlights the importance of wellness as it relates to MS, factors that contribute to your wellness, and current research efforts. The Society strives to provide the best program experience possible by offering tools you can use throughout your MS journey and opportunities to engage, ask questions, and connect with others. Our hope is that you'll leave this session with increased knowledge about the dimensions of wellness and how they play a critical role in your MS journey, clinical trials, and wellness research initiatives and recommendations for those living with MS. Let us know in the chat what you're most excited to learn about. This session includes a lot of information about research and wellness recommendations. The recording will be available on demand on the Society's website and in this virtual environment, so you'll have the opportunity to view it again and access resources. Now let's quickly review how the question and answer process and chat function will work today. This is your program, and your engagement is important to its success. The questions you submitted during registration have been incorporated into the program when possible. If your question is not answered or new questions surface, you will have the opportunity to ask it during the panel Q&A later today. We encourage everyone to ask questions in the chat or Q&A boxes throughout the program. Our MS navigators are here with us today to answer your questions and provide resources. We also encourage you to engage and support each other in the chat throughout the program. What you gain from this experience is directly related to what you put into it. I would like to acknowledge and thank today's premier national sponsor, Bristol Myers Squibb, our national sponsors, Genentech and Janssen, and our supporting sponsors, Novartis and Viatris. Support from MS community partners helps the Society reach our goal of providing up-to-date information and support through programs like Pathways to Wellness in MS. Now, I'm excited to hear about wellness research and the impact it has on the quality of life for those affected by MS. We know MS involves a comprehensive approach that will uncover solutions for everyone. Together, we are looking for the most promising research, the most effective therapies, and solutions you can use now to support your journey. To date, the Society has contributed over $1 billion. Yes, that was a B, $1 billion to fund research projects. And we've listened to you and know wellness is a trending topic in this ever-evolving MS arena. And that is why many of the funded projects are looking at health, wellness, and rehabilitation. Now, it is my pleasure to introduce Dr. Kathy Zakowski, the National MS Society's Senior Director of Patient Management, Care, and Rehabilitation Research. Dr. Zakowski will share the Society's initiatives supporting wellness research and the latest progress helping us manage MS more effectively than ever before. Dr. Zakowski manages the Society's research portfolio focused on clinical and rehabilitation care, as well as development of the Society's wellness initiative. In addition, Dr. Zakowski serves on the scientific leadership team of the Progressive MS Alliance. Thank you for being here with us today.
Thank you so much for coming together today. It's my pleasure to share with you the progress that has been made in the drive to stop MS in its tracks, restore what's been lost, and end MS forever. And I feel confidently that we're making tangible progress, that the breakthroughs will continue to mount, especially in wellness research. Now, many of us spend money on health and wellness, and we all want information about how to stay healthy, right? We all want to learn about what's healthy to eat, what exercises we should do, and what resources are available to help reach our wellness potential. And these are all good questions and answers to seek. But for a person living with MS, wellness means so much more. It can impact your progression, your lifespan. It's even essential to modifying the disease course, treating relapses, managing symptoms, and promoting safety and independence. So wellness can mean a lot of different things to different people. I mean, if you just Google wellness, you'll get over 2 billion results. That's a lot of information to dig through and try to make sense of. So I thought one way to start would be to even just define what wellness means in today's context of MS research progress. So wellness is a lifelong, personalized process through which you make informed choices about lifestyle, behaviors, and activities. It is multidimensional, involving several aspects that are interrelated with the ultimate aim of you leading your best life. So you might ask yourself, am I eating a healthy diet? Am I exercising? Am I staying as physically active as I can? And am I able to manage my stress? Just to name a few. We believe, along with the National Wellness Institute and other leaders in health and wellness, that wellness is an active process through which people become aware of and make choices towards a more successful existence. You must actively participate and make choices, so there's work involved. And the outcome leads towards success, meaning resilience, better resilience, and enabling you to thrive amid life's challenges. So if you're all ready to do this work, type "I'm ready" in the chat. Here we go. So lifestyle and wellness approaches are part of the comprehensive management of MS. And the dimensions of wellness shown here act and interact in ways that contribute to your overall well-being. And they're influenced by health and other factors. And they involve lifestyle behaviors and activities. And all of these things have an independent part as well as being very interconnected. And it's really important to recognize that no dimension is more important than another. In fact, we think that taking the time to nurture and develop each dimension contributes to greater overall wellness. So I thought I'd start by defining each dimension just briefly so we all have an understanding of those. So physical wellness, just as you might guess, would include making positive lifestyle choices about regular physical activity geared toward your abilities. This includes healthy eating, weight control, MS care and primary care, and preventive health behaviors, including stopping smoking, limiting alcohol use, and keeping attention to your personal safety. If we go to emotional wellness, this includes developing coping strategies to enhance problem solving, helping to manage stress, fostering a positive outlook, and developing resistance in the face of unpredictable changes, while paying attention to mood changes, including depression and anxiety that might require attention. There was a recent study by Jackie Batari that shows that African Americans living with MS experience more anxiety and depression. So this is something we need to learn more about so we can provide specific support to those in this demographic. If we move along to occupational wellness, this is engaging in meaningful and rewarding activities that promote a sense of purpose and accomplishment, including opportunities to contribute one's unique skills, talents, and knowledge to others at home, at work, or in the community. If we talk about spiritual wellness, this is developing a worldview that provides a sense of peace and harmony and enables you to cope and adapt throughout life, with the ultimate goal, again, of finding meaning and purpose in the face of one's personal challenges. If we talk about social wellness, this includes developing positive, healthy relationships that nurture interconnectedness with family, friends, and community, and promotes active engagement in a social network of meaningful and rewarding friendships and intimate relationships. Last, we'll talk about intellectual or cognitive wellness. This involves engaging in mentally stimulating and challenging activities that lead to personal growth, enhance creativity and new learning, while developing the ability to think objectively and independently. So understanding these various dimensions and the impact they have on wellness and lifestyle is the first step to learning how you can change your behaviors and make choices that impact both MS and the quality of life. So in this program series, we'll focus on physical wellness, specifically exercise and lifestyle physical activity. So there are several factors that contribute collectively to wellness and impact your well-being. And as you can see from this list, you have an influence over some of these factors. You can choose to engage in behaviors that support positive efforts to live with MS and enhance your overall health. Other things, such as gender and ethnicity, you have really little to no control over. Though we know now that research is showing that these factors contribute to your MS journey just as much as those that you can control. So ongoing collaboration with your primary care provider and your MS healthcare providers can help ensure a comprehensive health and wellness management plan. Age-related preventive healthcare, making sure you get your vaccinations, keeping careful attention to any coexisting medical conditions that can affect overall health and lifespan are just as important as managing your MS. Integrating healthy behaviors into your lifestyle can be hard work, even without the added challenges of MS. So take a moment to think about your potential barriers, those that affect you committing to a healthy lifestyle. Perhaps you don't think you have the time to exercise, or you find it hard to motivate yourself to be physically active on a regular basis. These challenges can make it difficult for you to stick to your wellness goals. So in the chat, share at least one challenge that you personally face that has impacted your wellness. Now, it's important to work with your healthcare team and recruit friends and family also to support you along this journey. Talk to them about your goals and ask for their support in helping you eat well, engage in physical activity, stop smoking, and maybe even just to get out of the house more frequently, or do whatever you're finding challenging. Now, the society is focused on wellness because people with MS have identified that and associated behaviors as a high priority based on something called social media listening, undertaken by the National MS Society. So social media listening is a marketing and public relations process for identifying and analyzing topics being discussed on blogs, message boards, and social networks. And we know from this process that people affected by MS are seeking information on approaches for living well more frequently than information on pharmacologic approaches for managing the disease. And that the most frequently mentioned approaches for promoting wellness in MS involve diet, exercise, and emotional wellness. So we hear things like, what can I do today to feel my best? Will lifestyle interventions, when combined with my conventional approaches, alter my disease course? And how can I get involved? So I hope to answer some of these questions for you today. So we know a great deal of progress has been made in the development of pharmacological issues that can help reduce relapses for many, and substantial research is underway to find therapies for everyone with MS. But the question today is, how can wellness interventions factor into this? So as you can see from this slide, there's been a large increase in the number of published papers in the area of wellness. So this is exciting as it suggests that scientists are thinking more broadly about non-pharmacologic approaches to address symptoms of MS that can be used to help people live their best lives. However, it's really important to recognize that although the number of papers published has risen substantially in the last 20 years, translating these findings to actual interventions is still very limited. One piece of this is that scientists have to ask the right questions, and they need guidance from people living with MS, and they need funding, and they need people to participate in their trials, and so they can conduct their studies. So to address these needs, the Society made research on wellness and lifestyle factors a priority. So because of your collective voices, the Society's influence matters. As you can see here, more research is being conducted in support of the development of specific lifestyle strategies than ever before. And with the continued support of the Society, a greater awareness to the importance of wellness strategies and interventions will foster progress in this area. But in order for this wellness research to continue, the field really needs you to participate. Without your participation, it would be impossible to develop new and better therapies and other interventions. So now let's take a moment to hear about participating in clinical and research trials.
So MS can affect anybody, any age from the very young to the very old. either gender, and different races and ethnicities. And there seem to be different risks attributable to each of those different subpopulations, and the disease course is sometimes different across all of those subpopulations. There are lots of questions we still need to answer about why MS is more prevalent in certain groups as compared to others, and why it behaves differently in those groups. And it's only when our clinical trials are inclusive and include everybody, including minorities, that we'll be able to address some of these questions about why things are different across different groups. Most of my patients and patients in our clinics are involved in research, but they often have questions like, is this an experimental treatment? Am I going to be experimented on? And I think it's important to convey that this is not an experiment about something that we know nothing about. It's usually something we know something about. We just don't know, for instance, which of two treatments might be better in certain age groups or in certain populations. And so they need to be evaluated. And the only way we can figure out which is better for you or for the next person is to study these things rigorously through standardized clinical trials. And that's why it's important to conduct these clinical trials so that we can compare in a really rigorous scientific manner one treatment versus another, for instance, to figure out which works best. And it's only then that we can make lives better for people with MS. For patients who are wanting to know how to get enrolled in research studies, including clinical trials, a great resource is the local or national MS Society. There are websites and phone numbers to call or to look at to find out more.
As you heard from that video, it's important to note that research and clinical trials involve pharmacological and non-pharmacological interventions. And non-pharmacological interventions are a kind of medicine focused on wellness that needs to be studied carefully. This includes diet and rehabilitation strategies, such as exercise or using technology devices that can assist with things like mobility issues. Other methods include observational studies. So using registries or online surveys that collect data and can detect patterns. These types of studies, the observational studies, can be done remotely. So they offer opportunities for those who want to contribute, but may live in more rural areas, have demanding schedules, or have mobility or transportation challenges. Now, the Society is a member of the MS Minority Engagement Partnership Network. This is a group that is addressing the problem of minority underrepresentation in MS research. Together, we're learning why racial and ethnic minorities are not fully represented in MS research and developing solutions to help increase research opportunities in these communities. So if you're interested, I encourage you to start the conversation with your healthcare providers. Don't be afraid to ask questions. They typically know information about the local area, or visit the Society's website to learn about participating in trials and see which ones are recruiting participants now. Or you visit resources. Some are listed on this slide, or you can go to the resources room in this environment during a break to learn about the opportunities to engage. So let's take some time to look at the Society's research priorities and how we determine where to begin. So research is formed through questions, and from questions you get hypotheses, or you start out with assumptions and then get to your questions. But first we need to ask ourselves, what do we want to know? And what do you, as individuals affected by MS, want to know? Maybe we want answers about risk factors. So why do some people get MS and others don't? Maybe we're interested in pathology, so answering the question, what's the cause of MS? Or maybe progression is really at the heart of this, and we would ask the question, how do we stop it? Or we could be interested in protection and repair. So how do we repair the damage caused by MS? And last but not least, we might be interested in health and wellness. And then we might ask the question, how do we reverse symptoms and promote wellness? Researchers around the globe are focusing on these critical questions about multiple sclerosis. And these 5 research priorities were developed by a task force of research experts with input from people affected by MS, society leadership, and MS researchers and clinicians. Making them a priority drives the work to find solutions to stop MS in its tracks, restore what's been lost, and end MS forever. And the Society uses these priorities to determine the relevance of research proposals and to identify gaps and our opportunities so that we can target funding. The last priority addresses learning more about pathways to wellness in MS. So research progress in this area can help to explain the causes of MS symptoms, the impact of comorbidities, and identify rehabilitation, wellness behaviors, and lifestyle approaches that impact the disease course, symptoms, and overall health. So we'll talk about this priority today and how to promote wellness with a specific focus on exercise and lifestyle physical activity. So emerging evidence suggests that wellness behaviors and lifestyle factors can influence the risk for developing MS, disease course, the severity of symptoms, and an overall quality of life. So finding ways to understand and address this variable and unpredictable symptoms caused by MS will have a profound effect on a person's quality of life. Now, in addition, people with MS often live with other chronic medical conditions. So understanding how these other health conditions affect the MS disease course and symptoms represents an important research opportunity. This work focuses on the design and conduct of clinical trials and providing strategies that people can incorporate into their life to enhance their well-being is important to be emphasized. A wellness research working group was convened about 6 years ago to foster research focused on wellness. Since wellness is so multifaceted, it's tricky to know how to scientifically address questions and find answers. It was agreed that at least 3 areas needed to be included to really encompass wellness research. And these are physical wellness, nutrition wellness, and psychosocial wellness. So this group is still ongoing and includes around 35 scientists, clinicians who study at least one of these areas. And the overall objectives of the group are to generate high quality wellness science, translate new evidence into practice, and to provide a network to collaborate. And this is one way that the Society is working to better understand wellness and fostering research that can provide evidence to back up what is recommended in terms of wellness for people living with MS. The Society is also focused on pursuing all promising paths to uncover solutions for everyone with MS, wherever these opportunities exist. So right now, the Society is providing $6 million for about 20 symptom management and wellness projects. This research going on right now is focused on lifestyle and wellness with the goal of providing results that will help people with MS live their best lives. Let's highlight a few of the projects that are currently underway. A team at the University of Oklahoma is testing a modified weight training program for clues to increasing physical function and improving quality of life in people with MS, helping to understand why some develop worse cognitive function and physical disability. A research project at the University of Washington is studying if aerobic exercise improves cognitive impairment in people with MS. A separate study at Rutgers University, researchers are testing whether providing rest intervals throughout walking rehabilitation efforts improves effectiveness. Researchers at the Tel Aviv Zakowski Medical Center in Israel and the University of Illinois at Urbana-Champaign are conducting a trial to test a rehabilitation strategy that addresses walking and thinking issues in a single integrated approach and combining virtual reality and treadmill interventions. And lastly, researchers at the University of Alabama at Birmingham have joined together to stimulate interdisciplinary research on lifestyle and wellness for healthy aging in MS. So let us know in the chat what research projects you're interested in learning more about. The Society also convened a group of experts in the fields of MS, exercise, rehabilitation, and physical activity to review the available studies and develop recommendations for healthcare providers so that they can use these to advise individuals with MS at all levels of ability. This group looked at both exercise and lifestyle physical activity to develop the recommendations. And these recommendations are published and are endorsed by the Consortium of Multiple Sclerosis Centers. So I want to highlight a few of these recommendations now and we'll dive into them in sessions 2 and 3 of this program series. So we are encouraging healthcare providers to promote exercise and lifestyle physical activity to every person with MS, emphasizing safety and benefits. And the recommendations encourage all people with MS to complete at least 150 minutes per week of exercise and/or lifestyle physical activity. So that's 30 minutes a day, 5 days a week. Now, keep in mind that this can be non-consecutive, so it can be broken up into multiple sets throughout the day. And this can include things like housework, as well as more traditional types of exercise. And individuals are encouraged to make gradual progress toward this goal. So based on what your abilities are, what your preferences are, and keeping safety in mind. Now, since other health conditions and symptoms can also be barriers, it's important to set goals in communication with your healthcare provider. If disability increases and physical activity becomes more challenging, you need to reevaluate your goals. You may need to work with an exercise specialist who's trained in MS to ensure safety and maybe to give ideas for new goals. When physical activity is very limited, individuals should exercise with the help of a trained assistant. So thank you so much for your time and attention. I hope you feel better informed about wellness and the Society's research priorities and progress.
Wow, thank you so much, Dr. Zakowski. There are so many exciting things happening in wellness research. Thanks to everyone who submitted your questions and engaged in the chat. Before we close out this session, I'd like to highlight tools that you can access to challenge yourself to use what you learned today to set goals, plan activities, and develop healthy behaviors. Built into this program series is a call to action or a program challenge. I want you to reflect on your personal wellness. Really take an honest deep dive, and then take what you learned and build out practical strategies to maintain or grow your healthy lifestyle behaviors. So I want to challenge you to rank your current status on a scale of unwell, neutral, well, for each wellness dimension. Identify factors that contribute to your personal wellness, either positive or negative, and think about how they affect you. And choose 1 to 2 wellness dimensions to devote time and attention to move you closer to well on your personal wellness scale. Worksheets to help you develop goals and track successes are available in the resources room. I hope you enjoyed hearing about wellness and research progress. We're going to take a 15-minute break so you can explore this virtual environment. I encourage you to chat with a live MS navigator. Try an exercise demonstration video. You may recognize the instructor. Check out our resources room. Connect with other participants throughout the text and video chat. And visit our program sponsor booths. Now, for those of you who like a little healthy competition, we do have a leaderboard. You'll get points for visiting different rooms and engaging with each other. So have fun, and we'll be back here in 15 minutes for the next program session, Wellness Through Exercise and Lifestyle Physical Activity.